Whooping cough or pertussis is an illness that's highly contagious. What we know is that adults don't get as ill from the bacteria as infants and children do. So adults carry the bacteria sometimes in their throat and can transmit it to infants or children that don't have immunity to the disease. So what we have available now since 2005 is a new vaccine that boosts the parent or the caregiver's immunity and protects them from getting the whooping cough or pertussis bacteria and thus transmitting it to the children. We often think that children and babies are safe in our arms, but if we're carrying bacteria in our throat that can cause whooping cough, transmit it to the baby, and the baby isn't protected, then they get seriously ill.
And what are some of the ways to protect the babies?
The best way to protect is to immunize the parents, the siblings, the aunts, the uncles, the caregivers around that child. Keep children who are too young to be immunized or not fully immunized out of situations where there's a lot of coughing going on. Staying away from suspect cases or known cases where there is whooping cough. Immunization for whooping cough cannot be started in a child until they're 2 months of age. At 2 months of age, they would get 1 dose. At 4 months, they would get the 2nd dose, and at 6 months, they would get the 3rd dose. They need 3 doses to have good immunity toward whooping cough. So until they're 6 months old, they're susceptible to the disease. If you immunize the mother while she's pregnant at 20 weeks or more, she actually can transmit some immunity to that infant before they're born. And when they're born, then they have a little bit of immunity to carry them through that initial immunization period till they have their own immunity developed. So the mother's like a cocoon to have the immunity for herself transmitted off to the baby so the baby doesn't get as ill, has a better chance, better protection.